cholinergic drugs. After cholinergic systems, we will discuss the drugs which affect the cholinergic system. What is cholinergic system? Cholinergic system is the system which respond to acetylcholine. All the sympathetic and parasympathetic neurons or nerves, ganglia, presympathetic, preganglionic neurons, postganglionic neurons, which are respond to acetylcholines are called cholinergic neurons or cholinergic ganglia, cholinergic nerves, right? So today we will discuss the drugs which affects the activities of cholinergic system or the activity of acetylcholine, right? Cholinergic drugs are the drugs which can affect the activity of cholinergic system. By two mechanisms. Either it will inhibit the cholinergic system or it will stimulate the cholinergic system. So by this stimulation and inhibition, these cholinergic drugs are divided into two classes. One is cholinergic agonists. And second is cholinergic antagonists. It is clear from their names that cholinergic agonist will mimic the activity or it will stimulate or enhance the activity of cholinergic system or acetylcholine, and these antagonists will block the activity of cholinergic system or it will inhibit the activities of cholinergic system or acetylcholine. So today we will focus only on cholinergic agonist, right? Cholinergic agonists are the drugs, these are the drugs which increase activity of cholinergic system. Increase activity of cholinergic system means that it will mimic the activity of cholinergic receptors or it will increase the activity of acetylcholine, or the drugs by itself will act like acetylcholine, right? And these cholinergic agonist drugs are further divided into two classes. These drugs are divided into two classes. One is called direct acting cholinergic drugs or cholinergic agonist, and one is called indirect acting cholinergic agonist. What is the difference between direct acting and indirect acting? Anyone? What does it mean? Direct acting and indirect acting drugs. For example, we have neurons, cholinergic. This is cholinergic neuron, and this is, for example, the effector site. Other neurons are muscle cell, and of course we have nicotinic receptors here. Nicotinic receptors here, and for example here is another neuron, postsynaptic neuron, and on these neurons we have 7 pass receptors which are muscarinic receptor, right? For example, this is the vesicle, and in vesicle we have acetylcholine, and by exocytosis acetylcholine will release into synaptic cleft, and these are the nicotinic receptor. To these nicotinic receptor, this acetylcholine will attach and will activate these receptor, right? And after the action, for example, this is the acetylcholine, having two groups. One is choline and second is acetate, acetylcholine. Right? Here is one very important enzyme which is called, this enzyme is called acetylcholinesterase or cholinesterase enzymes. Right? What is the role of this enzyme? This enzyme break down this acetylcholine and will reabsorb this choline to the axon terminal and will recycle the acetylcholine into synaptic cleft. Now, the drugs, for example, this is the muscarinic receptor and acetylcholine are acting on this muscarinic receptor and will stimulate this pathway. And also here we have the same enzyme which is called cholinesterase enzyme, and cholinesterase enzyme is responsible for recycling of acetylcholine. Right? So now the drugs, for example, this is the drug. This is the drug and it attacks directly on these receptors. And for example, it is just like acetylcholine and attached to these sites and activate the receptors. These are the drugs which are look like acetylcholine, right? Are synthetic drugs or natural drug, but they have similar structure to acetylcholine. These drugs are called direct acting drugs because these drugs directly attack on nicotinic or acetylcholine or cholinergic receptors. Right? There are some drugs, for example, this is the drug this drug, for example, it attacks on this enzyme and inhibit this enzyme for not consuming this acetylcholine. So acetylcholine amount will be increases in synaptic cleft and this pathway will be stimulated. These drugs are called indirect cholinergic drugs which are acting on enzymes, and the drugs which are directly acting on receptors, they are called direct acting. Right? So cholinergic agonist drugs are divided into two classes. One is called direct acting cholinergic drugs and one is called indirect acting cholinergic drugs. Right? So it is now clear that these drugs will be acting on enzymes. There are two types of enzyme for these drugs. One is acetylcholinesterase and one is butyrylcholinesterase. Butyrylcholinesterase are present in plasma because this acetylcholine is not able to penetrate into the cell membrane. So there in plasma the similar enzyme but called butyrylcholinesterase are responsible for breakdown of acetylcholine. Right? So these indirect acting drugs are acting on enzymes and the direct acting drugs directly acts on receptor. The direct acting drugs, these direct acting drugs are further divided into two classes. One is which are choline esters. Choline esters means synthetic, which are look like acetylcholine, and one are plants alkaloids which are directly extracted from plants called plants alkaloids. Right? The drugs which are cholinesterase are, the first drug is acetylcholine. Right? The second drug is methacholine. Methacholine, it means that it is acetyl group is replaced by methyl group. Right? The third is Bethanechol. And Bethanechol is only muscarinic acting drugs because it will inhibit the nicotinic or it diminish the nicotinic activity by adding methyl group, additional methyl group. I will discuss this in Bethanechol. And the last is carbachol, or it is also known as carbamyl choline. These are choline ester direct acting cholinergic drugs, right? And now these plants alkaloids are the one is which is very simple called muscarine. Why muscarinic receptors are called muscarinic receptors? Because they are sensitive to muscarine, and muscarine is extracted from mushrooms, one type of mushroom, very toxic mushroom, and these are the alkaloids extracted from that mushrooms, and therefore it is called plant alkaloids. And the second is, which is very useful in clinical trials, is pilocarpine. These are direct acting cholinergic drugs. The second is indirect cholinergic drugs. Indirect cholinergic drugs. Indirect cholinergic drugs are, you will already know these names. Neostigmine. I have discussed these drugs in neuromuscular junction. Right? Neostigmine. Physostigmine. Pyridostigmine. Rivastigmine. Donepezil. Edrophonium. These are the drugs which are called indirect acting cholinergic drugs. Direct acting are acetylcholine, methacholine, bethanechol, carbachol, muscarine, pilocarpine. The indirect acting are neostigmine, physostigmine, pyridostigmine, rivastigmine, donepezil, and edrophonium. These are indirect drugs. Now we will discuss these drugs one by one. What are the indications of these drugs? What are the side effects of these drugs, and what are the contraindications of these drugs? These are three main parameters which we will discuss in all pharmacology for drugs, right? Now revise. Cholinergic drugs are two types. One is cholinergic agonists and cholinergic antagonist. It will stimulate the cholinergic system and it will inhibit the cholinergic system. Our today topic is cholinergic agonists, so we will take only cholinergic agonists. Cholinergic agonist. Cholinergic agonist drugs are the drugs which can enhance the activity of cholinergic system. Right? Cholinergic agonist drugs are further divided into, for example, these are cholinergic agonists. Cholinergic agonists are further divided into two types. One is direct acting and one is indirect acting. And now you are well aware about indirect and direct acting cholinergic agonist. Direct acting drugs are further divided into two classes. One is called choline esters. Choline esters are first acetylcholine. Second is methacholine. Third, Bethanechol. And fourth is carbachol. Now listen carefully. This acetylcholine is muscarinic as well as nicotinic. Right? We have discussed this in neuromuscular junction that is acetylcholine is muscarinic as well as nicotinic. This methacholine is purely muscarinic. This bethanechol is purely muscarinic, and this carbachol is muscarinic as well as nicotinic. So you can divide these choline esters into nicotinic and muscarinic, right? The second class of this direct acting drugs is plants alkaloids. Plants alkaloids. They are first muscarine and second pilocarpine. Indirect cholinergic drugs are number 1 new stegmine. These are the drugs which are favorably used in myasthenia gravis. New stegmine, pyzostegmine, pyridostegmine. Second is physostegmine. Third is pyridostegmine. Fourth is rivastegmine. Fifth is donepezil. Sixth is edroponium. These are direct and indirect cholinergic agonists. Right? Now we will take acetylcholine and we'll discuss acetylcholine. After we will take bethanechol, because methacholine have no such type of clinical trials, so it only used for diagnosis. We will discuss this. Then we will discuss bethanechol. Then we will carbachol, right? And muscarine and pilocarpine will be discussed in another lecture, right? We will cover these 3 or 4 drugs today, right? So for example, let's start from here. Acetylcholine. What is acetylcholine? I am starting from here. First is acetylcholine. Acetylcholine is synthesized in axon terminal, and this is a neurotransmitter which is used in the sympathetic as well as in parasympathetic system, right? So acetylcholine is a neurotransmitter. First of all, acetylcholine is neurotransmitter. Second, acetylcholine is formed of 2 groups. One is choline and acetate, right? And this is quaternary ammonium compound, right? Acetylcholine is quaternary ammonium compound. Next, it cannot easily or it cannot penetrate biological membranes like placenta, like blood-brain barrier, like gastrointestinal mucosal barrier. It cannot cross these membranes. Why? Because acetylcholine is heavily charged molecule. Right? Acetylcholine is heavily charged molecule. The only function of this acetylcholine is to mimic the activities of parasympathetic and sympathetic cholinergic system. Right? The next, what is the structure of acetylcholine? Structure of acetylcholine. It have acetate group. First of all, for example, it have acetate group. Second, these are esters, right? Third, it have choline compound. And this is very heavily charged molecule with having positive charge here. This is the structure of acetylcholine. And now when we are making the synthetic other drugs like acetylcholine, we will remove the groups from acetylcholine and will replace by other group and will form other drugs, right? Acetylcholine action is very short acting molecule. It is very short acting molecule or drug, very short acting. Its action ends in just in 30 seconds, right? The second, acetylcholines are very rapidly degrades, deactivates. By which enzyme? Acetylcholine esterase. Deactivating by acetylcholine esterase. Right? Third, this drug have a very short half-life. And the drug having very short half-life are not suitable for clinical trials. Right? Next, it cannot cross biological membranes. We are talking about that when we are using acetylcholine as a drug from external side. When we are injecting acetylcholine, what will happen to acetylcholine? It is very short acting. It is very rapidly degrade or deactivate by enzymes, right? And it is having very short half-life, mean it have very short duration of action. At a very short duration of action. Duration of action. The other point which is very important, acetylcholine is the neurotransmitter of all the sympathetic and parasympathetic system. So if we inject acetylcholine, a lot of activities will perform in our body. The muscles contraction, salivation, GI motility, right, bronchial constriction, etc., urination, defecation, all are stimulated by acetylcholine. So we can say that acetylcholine is multi-diffused, having multi-diffused effect on many systems. Due to these reasons, acetylcholine is not suitable for clinical trials, and this is not used as therapeutic agent, not used for treatment, right? Acetylcholine is not used for therapeutic effects due to all these reasons, right? But acetylcholine have very important pharmacological actions in our body, right? Very important. For example, now we are talking about pharmacological action. There is a difference between pharmacological action and clinical action or therapeutical actions, right? Pharmacological actions may be more than one, right? But clinical effects are not more than one or two, right? Pharmacological actions of acetylcholine. Now you will tell me, because we have already discussed the pharmacological actions of acetylcholine. The first one is the pupil or contraction of, specifically contraction of ciliary muscles, because it have also affect the sphincter papillae muscles, right? And it is also related with the pupil dilation and contraction, right? Next is it decrease the heart rate. So it decrease the heart rate. Due to this decreasing, it also decrease cardiac output, and when cardiac output is decreases, it means it also decreases the blood pressure. But The blood pressure is also decreased by another mechanism. This, for example, here it also decrease the BP by decreasing cardiac output, but here it decrease the BP by deactivating the firing in SA node, because SA node have M2 receptors, and when acetylcholine acts on M2 receptor, M2 receptors are GI receptors, and when GI receptors are activated, that means the biological function is inhibited. So it decrease by decreasing firing in which type of firing? Vagal firing, because SA node is innervated by vagus nerve. Vagal firing in SA node, and due to this firing, decreasing in this firing at SA node, it will decrease the blood pressure, right? Next, what is the effect of it increase the gastrointestinal motility, right? So when it increase the gastrointestinal motility, so it will increase defecation, right? Next, it increase the GI secretions. For example, salivary secretion, it increase salivation, it increase peptic secretions, it increase gastrin, etc. It also increase the secretions in intestines. These are the pharmacological actions of acetylcholine. Also, it increase urination. Why? Because there are muscarinic receptors on detrusor muscles, and when they are activated, urination will be increases. So it increase urination. These are the pharmacological actions of, these are called the general or systemic pharmacological cholinergic actions, which are mimicked by acetylcholine, and due to these reasons, this acetylcholine cannot used in clinical trials, because if, for example, if we have atonic bladder, mean without obstruction urine is not passing, and we give an injection of acetylcholine, it's right that it will increase urination, but with this urination it will increase secretion, it will increase defecation, it will increase salivation, it will decrease the blood pressure, decrease the heart rate. So these are the diffuse actions of acetylcholine, and due to these diffuse actions we cannot use acetylcholine as a medicine, right? So this is acetylcholine. Now we will go for Bethanechol. Bethanechol is clinically important drug. Bethanechol. What is Bethanechol mainly? This is a precursor of, or this is the structural same drug with acetylcholine, but we have replaced the acetate group by carbamate group. That is replaced by carbamate group. So first of all, an introduction in Bethanechol, acetate group is replaced by carbamate, right? Second, an additional methyl group, means CH3, is added to Bethanechol, right? And due to this additional CH3 group, it is not acting on nicotinic receptors, and due to the addition or replacement of carbamate group, this is resistant to acetylcholinesterase. When it is resistant to cholinesterase, it means a duration of action will be increases, and these acetylcholinesterase are not able to destroy the bethanechol now, right? So these are the 2 points. Due to carbamate cholinesterase, acetylcholinesterase cannot metabolize the methanechol, right? Here is one other point which I am going to mention here, that this is not, acetylcholine is not specifically acting. It have a lot of action. Acetylcholine is not acting specifically on one receptor. So acetylcholine not acting specifically, and this bethanechol is specifically acting on muscarinic receptor. Why? This is because of this methyl group which we have added to the skeleton of acetylcholine, right? So due to CH3 additional methyl group, bethanechol cannot acting on nicotinic receptors, right? Now what is the structure of this bethanechol? For example, this is we have replaced this thing by H2N carbamate group, right? And here to this first group we have added methyl group CH3. This is the additional methyl group, and the other structure is same too. Structurally it is similar to acetylcholine, but specifically it has 2 additional groups. By one additional group it make itself resist to cholinesterase, and by other additional group it cannot act on nicotinic receptor. So first of all, because acetylcholinesterase cannot affect the bethanechol, so duration of action is cannot affect the bethanechol, so duration of action is increases, duration of action, right? And when duration of action is increases, it means the half-life is also increases, and because it staying in body for a long time, so it can be used in clinical trials. Now, and clinically specifically this drug is used in 2 systems, the gastrointestinal system and urinary system. Gastro, and have 2 actions, urological actions and gastrointestinal action. So first of all, we are discussing the indications of, what's mean by indications? Uses. Indications of bethanechol. First, in urinary system or in urology. Remember one point with yourself. These drugs are used when there is no obstruction in body, right? For example, if we have nephron, this is nephron, and for example we have a stone stuck in here. This is a stone. It's mean there is obstruction. and these drugs are enhancing the activities of construction. And if you are giving the drug to this patient, he or she will be suffering from a very severe pain behind his stone, because the urination is constricting and there is obstruction, and at last it will be burst, the kidney will be burst. So these all drugs are contraindicated in the bodies which have some type of obstructions. They may be stone obstructions, they may be constipative obstructions, they may be prostatitis obstruction. These drugs are now then contraindicated. The first indication in urology is it is used for post-operative urination. Post-operative atonic bladder. When urination is stopped after surgery due to anesthesia, we can stimulate this urination by Bethanechol without passing the catheter. Right? Second, postpartum atonic bladder. It means after deliveries or after C-sections, when the female cannot pass urination and without catheterization to pass the urine, we will give Bethanechol. And what is the action of Bethanechol in urinary bladder? Anyone? For example, this is the urinary, and remember one point here, that it has no effect on the sphincters. Right? Bethanechol have no effect on sphincter. It is used when the sphincter is not working. Right? So for example, here are the detrusor muscles. These are detrusor muscles in urinary bladder, and these are the ureters coming from the kidneys. And these muscles, for example, these muscles have the receptors, and when you are giving the Bethanechol, it will activate these receptors, and contraction and the detrusor muscles will be started, and when these muscles are contracted, the urine will pass through urethra. Right? So it can be used in post-operative atonic bladder or postpartum atonic bladder. The next, it can be used in neurogenic atonic. Atonic means there is no tone in the bladder, no muscle tone in bladder, and the bladder is not contracting. Right? So neurogenic atonic bladder, when there is low perfusion from the brain or autonomic nervous system to the urinary bladder, and they are not working, so we are giving Bethanechol for enhancing the activity of nervous system for renal reflexes. Right? For urination. Right? So in this condition, the urination will be increases, and this is the general effect of the acetylcholine. The next effect of the Bethanechol is it can be used in hypotonic bladder. Hypotonic bladder. Hypotonic bladder. When the tone of the muscles is decreasing due to some reason without obstruction, it can be treated by Bethanechol. These are the urological indications of Bethanechol. Now the gastroenterology are the gastric indications of Bethanechol. Gastric. First one, when there is ileus condition, ileus stomach. Ileus stomach means paralyzed stomach. We can activate this by Bethanechol. Right? The next is when there is adynamic or post-operative adynamic gastric intestinal ileus. Ileus means paralysis, right? And there is no gastric motility in the intestines. Gastric motility is very important for defecation or anything else in the intestines, and there is ileus in the intestine due to anesthesia or any other effects, but there is no obstruction in the intestine, so we can stimulate this activity or GI motility by Bethanechol, right? The next indication of this is ileus to any toxic thing, ileus to any toxic things. Any toxic compound or chemical. When you are when you ingest a toxic thing which can cause the ileus or paralysis of the intestines and gastrointestinal system, we can stimulate these ileus by Bethanechol, right? That's the next indication in gastrointestinal system. The next is congenital megacolon. Congenital megacolon. Congenital, what is mean by congenital megacolon? When the colon become very dilate, and because of this is because of when it not taking the impulses from brain. There is some area in the last parts of the large intestine which having no parasympathetic innervations, and due to some reasons when these areas cannot getting the impulses from the gastrointestinal system, it become dilated unexpectedly. It can dilate and cause abdominal distensions, right? For example, this is the cecum, and this is the ascending colon, this is the transverse colon, this is the descending colon, sigmoid colon, and rectum, right? And here appendix, and here is ileum, right? And due to this dysfunction or low activities of the central nervous system, which cannot giving impulses to these parts of the large intestine, it become dilate like this. This is called megacolon, and it cause abdominal distension. What is abdominal distension? It look like that your abdomen is swelled up, right? For example, this is the and this is her abdomen, right? This is called abdominal distension, and this may be caused by megacolon, and this is due to the cholinergic activities, the lack of cholinergic activities from the brain. So we can treat this megacolon by Bethanechol. Bethanechol is activator of cholinergic system, and when cholinergic system is activated, this megacolon will be constricted again. Dilate she. What are the contraindications? Now, first of all, what are the contraindications of COPD, chronic obstructive pulmonary disease? First one, why? In COPD, we have bronchial constriction, and if you are giving Bethanechol, it will enhance the constriction in bronchus or bronchi, and due to that, the COPD will goes to severe conditions, right? So, Bethanechol is contraindicated in COPD. Second, it is contraindicated in peptic ulcer. Why? Why it is contraindication in peptic ulcer? Because all the drugs which are like acetylcholine will increase the gastric secretions, and when there is peptic ulcer, the acidic environment will be increasing due to Bethanechol because of the secretion, so it will be goes to severe condition, or it may cause the stomach perforation, right? This is the next thing, hypotension. Why Bethanechol is contraindicated in hypotension? ब्लड प्रेशर मग सरा डिक्रीज के कल तब हाइपोटेंसिव पेशेंट लवर के खबे दल डिक्रीज की और दे चाचे क्लास से वर्षे सर्जिकल वाले वर्षे चाचे क्लास से वर्षे IHD, it is also contraindicated in IHD. What is IHD? Ischemic heart disease. Why? Because it causes the vessels constriction, and when there is IHD, the vessels are already constricted, right? So IHD will be goes to severe states, right? Next is hyperthyroidism. This drug is also contraindicated in hyperthyroidism. The next, very specifically, it is contraindicated in Parkinson's disease. What is Parkinson's disease? I have discussed this in detail. When there is imbalance occur between the dopaminergic and acetylcholinergic pathways in brain is called Parkinson's disease. What is the main symptom of Parkinson's disease? Tremors, muscles tremors. So for example, this is dopamine and this is acetylcholine. They are working 50-50 in balance. And when there is disturbance occur in this condition, what is the disturbance? The cholinergic pathways become and the dopaminergic decreases in Parkinson's disease. Now, if you are giving the cholinergic agonist, this pathway will more increases, while more enhance, and will more it will cause tremors in body. So therefore, in Parkinson's disease, the Bethanechol or the cholinergic agonist is contraindicated. So these are the contraindication in for Bethanechol. What are the side effects of Bethanechol? What are the side effects of Bethanechol? All these are the side effects of Bethanechol because these are generalized cholinergic functions. It will increase the salivation, it will increase the gastric motility, so it will cause diarrhea, right? It will increase the diastolic muscles contraction, so it will cause urination, more urination, polyuria. It will increase the defecation, it will increase the peptic secretions, right? It will increase all the secretions in body. It will increase the constriction of smooth muscles. So all these are the side effects of Bethanechol, right? These are the two drugs which have been covered from cholinergic agonist. Now we will go for carbachol. Chale da ki kino.